Welcome, everyone. Sorry again for the delay, but like I said earlier, I'm sure it's going to be worth it. This is our Missouri Open Door Benefits Series. Know Your Rights on Medicare and Medicaid. It is being brought to you in part, sponsored by the MIPA 3, all three collaboratives. The MIPA Missouri SHIP is our MIPA 1, and Health and Senior Services is MIPA 2, and UMKC, Institute for Human Development, is MIPA 3. We all collaborate together to bring you this information. Missouri's No Wrong Door is transforming the way people access services in the community, support individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and support regardless of age, income, and disability. Our goal here is at opening the door is to surround the individual, your loved one, with services instead of separating them from the community or separating them from the family. It's making services and supports available equally through all connections. And through this series, we have the Missouri Open Door through technology. And then with today, we have our Missouri Open Door Benefits Series. The Benefits Series is hosted the second Wednesday of every month from 12:30 to 1:30, and it focuses more on the eligibility part of our integrated star. And then our technology series is hosted the fourth Wednesday of every month at 12:30. And it focuses on incorporating technology to assist with our loved ones. As Colette mentioned earlier, in case you missed it, any of the series that you may have missed are available in our Charting the Life course YouTube station, and we will put that in the chat. So after we finish editing this one and recording it and editing it, it will be available, but any of the other ones that you may have missed back will be there as well.
Thank you so much, Deshawn, for your introduction on MIPA 3. My name is Sonia Baskren. I am with the Missouri SHIP program, and we are going to start off your Know Your Medicare Rights series with Judy Caseman, our statewide outreach lead. Judy, you can take it away.
All right. Good afternoon, everyone. Thank you for joining us today. A little rocky start, but we're going to see if we can maybe give you some good basic information and some trusted resources that will help you along the way with either you as an individual or your family member or even your friends in your community. So our session today is going to kind of be at a kind of a high level in order to get through everything. I'll be doing the Medicare section of it, and Samantha Burke is going to join us for the second half, which will deal with Medicaid. At any time, if you have questions, if you would put those into the chat section, we will do our best to answer questions as we can. If we do not get to all of them, you might want to also enter a contact information so we can follow up with you with answer to your question. So we're going to start out today with discussion in several areas. And I'm going to do a brief introduction on the Missouri SHIP program, because you will see as we go through the presentation today, many of the services that we provide are areas that help protect your rights or assist you with appeals and grievances that you might need to file. We're also going to take a look at some general Medicare rights. Then we'll look at personal health information access, because we all have to protect our own health information. And then there's some situations that I'm going to talk about today that might be of interest to you, where you or your family members find themselves. So it might be that you're part of a Medicare Advantage plan, or you're in a skilled nursing facility right now. And so we'll give you some hints on how to protect yourselves in those situations and what your rights are. So starting off, I'm going to do a brief introduction to you as to who Missouri SHIP is, to let you know that we are the Missouri State Health Insurance Assistance Program. Our role in life is to provide counselors that are trained and experts in Medicare to provide free, unbiased advocacy, education, and assistance to Missourians who have Medicare, with the ultimate goal of everyone being able to make informed decisions about their health care and also to consider the financial aspect of that. We also are part of a national network that is found in every state, plus the territories. Our program, the SHIP program, was established in 1993. And again, the main purpose is to provide Medicare education and assistance. And also we're able to give feedback to state and local problems where we have some issues with Medicare. The thing I do want to stress is that SHIP is not a health insurance plan. It's not a provider. It's not an insurance broker or anybody that does sales. We don't promote anything. It's a national program that is funded through grants from the Administration for Community Living. And our whole role in life is to educate people so that they're able to make good decisions about their health care when they're on Medicare. Our counselors do a number of things as far as representing and promoting our program. They do a lot of education, assist in recruitment, and where you'll find they're probably of most assistance to you all is in doing the counseling and the enrolling. And the counseling is actually working with you on any Medicare problems that you have. And we can do that by phone, face-to-face, or virtual. And then the enrollment, if you qualify for low-income subsidy or MSP programs, we're able to get you screened for that and get you enrolled. So if we look at the things that Medicare counselors do, the two I want to draw your attention to is the Medicare prescription drug plans, the public benefits screenings, and the appeals and grievances. And you'll hear me mention those particular topics in various parts of the presentation today. And I just wanted to let you know that we are available to help if you find yourselves in those situations. So as we talk in general about your rights, I'm looking at just in general, your overall Medicare rights. They kind of fall into what I refer to as the right to be's, the rights to haves, or the rights to get. So be, have, and get. So if you are in that section of looking at the right to be, that includes being treated with courtesy, dignity, and respect, regardless of where you go through in the healthcare system. It also is the right for you to be protected from discrimination. You cannot be treated differently because of your race, the color of your skin, your national origin, a disability, age, religion, or sex. The right to have is to have your personal and health information kept private. You can only share your health information with those that you deem worthy of having your information. You also have the right to have access to doctors and specialists and hospitals for any of your medical necessary services, and that could be inpatient, outpatient, doctor's office, and those types of things. When we get to the right to get, there's a little bit longer list. But when we're talking about the right to get information, you have a right to Medicare covered services in emergency. Sonia, can you advance, please? Thank you. And you have a right to information in a way that you understand, whether you're getting that from Medicare, CMS, whether you're getting it from healthcare providers, or under other circumstances that might include contractors. And when we say contractors, that's basically looking at insurance companies, those types of things. So that information you have a right to understand. And the way that you get that can be through clear language that you can understand, not some high-level medical jargon that is used, because you have a right and a willingness to participate in your treatment decisions. And if you don't understand what they're telling you your options are, your decisions may not be what you want them to be. Also, Medicare information and healthcare information needs to be in a language that you understand. CMS, which is the Center for Medicare and Medicaid, offers a variety of material that is in different languages, Spanish, Korean, and you can access that. And I'll talk with you a little bit about how you can check out the Medicare site to look at what all those languages are. And you can order those directly so that you understand what you're getting, and your providers need to have that accessible to you also. We also, your right is to have information in a format that works for you, and that could be large print or it could be Braille. The other thing that you have a right to get are answers to your Medicare questions, and that can be from your doctor, from somebody within the healthcare system, or anyone that might be at CMS or within a service agency within the state. You also have a right to have a decision about your healthcare payment so you know what to expect. Coverage of items and services, again, so that you know what to expect and what might or might not be covered, and to know that your drug coverage is going to be accepted, and that your medications that you're taking are going to be covered. So when you talk about the types of information that you need to access for your personal health, you or your legal representative have the right to look at electronically any of your medical records, or you can also ask for printed copies of your personal health information. And all of that is protected by a law called HIPAA that was implemented in the 1990s. And that stands for Health Insurance Portability and Accountability Act. Basically, to break it down, it's identifying for you how an organization maintains their medical data, your personal health information, and under what circumstances they will release it.
I'm going to have you go.
And when you go to your doctor's office, for example, or to the hospital, one of the documents that they will hand to you and ask you to look at and possibly even sign is their HIPAA policy for their organization. And again, it's an attempt for them to say, this is how we are protecting your health information. Now, you can at any time request, let me back up a minute. Health information can also include claims and billing records. So it's not, and any medical case management records that you might have. If you're in a hospital setting, it could be a complete medical record, which would cover any physical therapy, outpatient therapy, medications that were given. So it can be any of those types of protections that's covered under HIPAA. Now, if you want to get copies of your medical record, you can request that be in paper or electronically if there's portals that can be used. Any place that you go to request copies of your record to be sent, they are going to ask you to complete a form that identifies what you want to have sent and the time period. If they don't do that, you need to be asking for that, because that covers you when it comes to what was released. And in many situations, there may be a copy fee associated with your record, especially if it's in paper. So if it's electronic, sometimes those are not necessarily charged as much, but there are organizations that will charge a flat fee for a copy of your record, and then so many cents per page over that flat number of pages. So to protect yourself and not get a surprise when you pick up a medical record that's 1.5 or 2 inches thick, that might cost you close to $100. You always want to make sure that you ask what their charge fee is for submitting your records. If they're electronic records, those are pretty easy and there's not as much wait time. Sometimes to get paper copies, you can wait as long as 30 days. Electronically, they should be able to get to those a little bit easier. So now we're going to go into what I'm calling situational rights. And when you have Medicare, there are rules, as we've kind of discussed, that protect your right to fair treatment, access to helpful information, and privacy of your personal and health records. If you have additional rights in certain situations. So what we're going to talk about next is original Medicare, Medicare Advantage plans, SNFs or nursing homes, home health, and hospice services. And there's a little bit different rights associated with each of those. So let's take a look first at original Medicare. And with original Medicare, you have the ability to see any doctor or specialist, including women's health specialists, as long as they participate in Medicare. And that's a really important thing to always ask if you're starting with a new doctor, to ask them up front, do you participate in Medicare? You can choose admission to any Medicare certified hospital that's going to be a participant in Medicare. With original Medicare, you can receive information, notices, you have appeal rights. You can request an appeal of health coverage or payment decisions that were made that maybe you didn't agree with. And you can also buy Medicare supplemental insurance, which you may hear referred to as a Medigap policy. And here in the state of Missouri, we do have a series of Medigap policies that our counselors would be happy to explain with you in the event you wanted to participate in that. Also with Medicare, if you have Medicare drug coverage, your plan that you choose that will send you out a packet of information, and in that packet will be documents that will explain your rights as a participant in their drug plan. So that would be with original Medicare. Now, if we talk about Medicare Advantage plans, basically you have the same rights and protections as anyone that has Medicare. One of the differences is you can choose healthcare providers, but they have to be within the network or within the plan with your Medicare Advantage plan. You can't just go to anybody unless you want to pay an out-of-plan charge, and that can get pretty expensive. You should receive a treatment plan from your doctor from complex or serious medical conditions. You have the right to receive that. And women also have the right to go directly to a women's healthcare specialist without getting a referral from the plan if they're going for routine or preventive healthcare services. Some people are interested in knowing how their doctors are paid. And you have a right to ask your plan how it pays its doctors, and they must tell you. Medicare does not allow a plan to pay doctors in a way that would interfere with you getting the care that you need. You can also file a complaint about concerns or problems with your plan, and you can also request an appeal to resolve any differences that you have with your plan. So you get two options there. You also have a right to get a coverage decision or coverage information for your plan before you receive the services, so that you can be assured that for the Medicare Advantage plan, that the choices that you've made with doctors and facilities are all going to be covered before you receive the service. And they will also provide you with a written explanation for drug coverage. And that will be called a coverage determination, which is a little bit different than the way original Medicare works. That coverage for determination is the first decision that your Medicare drug plan, not a pharmacy, but your drug plan, will take into account about what benefits that you would have with your drug plan. And so if you receive, when you receive your coverage determination, if you have questions, there should be phone numbers for you to call and make sure that you understand what your drug coverage is under a Medicare Advantage plan. We also have a skilled nursing facility that you may find yourself in for rehab. I went to one for rehab on my knee. And the laws for rights vary by state. However, skilled nursing facilities must provide you with a written description of your legal rights. And that may mean that you get that information in a little folder with individual sheets of paper. The place that I went for rehab on my knee actually had a little bound packet of information that covered everything from A to Z, all the way from what your rights were, what the financial aspect of, what they expected of you. And so that can vary, but they have to provide you some type of a written description of what your rights are while you're in their facility. I highly recommend that you retain that information that they provide to you because it should include rights, admission, transfer policies, maybe other pieces of information. You never know when you might need to refer back to that. Or if you find that you've had a problem with them, you have something to go back to for reference if you decide to file an appeal. If we're looking at nursing homes, again, state law is going to identify your rights and your protections, but please know that you have the right to be informed. In other words, people have to talk to you about what is being done to you, what your services are going to be. You're allowed to make your own decisions and have your personal information kept private. Those are 3 rights that you and your family need to always remember in a nursing home setting. Your rights must be explained verbally and in writing in the language that you understand. And that might include talking to you about how you act while you're in the nursing home. What are you responsible for? Any of those types of things that are going to identify what's expected of you while you're in a nursing home setting. And that discussion needs to occur either at the time of admission or even better before if possible. And they may very well remind you during your stay of what conditions are still needed. They may ask you to acknowledge in writing that you received that information, and the same thing may happen in the skilled facility where you need to sign that you've received the information, that it's been explained to you in a way that you understand, and that you accept responsibility for your actions while you're there. The other thing that nursing homes must provide you, both verbally and in writing, is about how to apply for and use Medicare and Medicaid benefits. And they need to prominently display written information about Medicare and Medicaid benefits. And they must give you information on how to get refunds if you have previously paid for a service that Medicare or Medicaid covered. So in other words, you don't want to get the same test in a few days and be expected to be charged twice for that. So when we look at our home health services, again, law identifies your right, and you can choose your own home health agency. You have a right to have your property treated with respect while you're receiving services. You should receive a copy of your care plan and participate in decisions about your care. And again, understanding what you're being told as far as what you need to do to help yourself while you're in home must be given to you in a way that you understand. A family member can serve as your guardian if you are unable to make some decisions or maybe do not understand what's being said. And you should receive a written copy of your rights from that home health service. And again, I would recommend that you not only retain it, but read it so you know what's being expected. In a hospice situation, again, the law is going to come into play here, and you have a right to decide whether to receive services at home or in an inpatient setting. It's important that you realize you have a right to participate in your own treatment plan. You have a right to receive effective pain management, and you also have a right to refuse treatment. And the important thing for folks that are in hospice is being able to choose your own physician, and you do have a right to do that. I've put together a little table here that's called Trusted Sources of Information. And these are sources available to you that you can request information, or you can go online and do your own search if you're inclined. I've listed here Medicare.gov, good for just general information. HHS.gov for the HIPAA privacy rules, and that's a good one to be able to have access to. Here in Missouri, we have an ombudsman program that's awesome that can be of assistance on many things, and one of which is your right if you feel your rights are violated. There's a Missouri survey agency through dhss.mo.gov, which addresses nursing home concerns and is available for you to express those concerns. And then with Missouri SHIP, which is where Sonia and I are employed, we're here to assist with Medicare counseling, appeals, drug plan comparisons, general Medicare assistance. And we're open year-round, 5 days a week. So we also wanted to put up here, if you would like to participate in other education opportunities, you can go to missouriship.org/education and click on the virtual education tab, and you will see education between now and the end of the year. Available to you at no charge. And I do want to make a point too, in case I fail to do that, is that Missouri SHIP does not charge for any of our services. So you can come however many times you need to ask questions, to get assistance, and there's never a charge for that. So are there any questions before I pass the baton to Samantha to discuss the Medicaid rights?
I do not have anything as of right now, Judy.
Okay, that sounds good. Well, I want to thank everyone today for being here and learning hopefully a little bit more about your Medicare rights. I do hope that you found the content worthy of your time. Time is precious and valuable, and so hopefully you received good information today. I'm going to turn it over to Samantha right now for the next part of today's presentation on Know Your Medicaid Rights. So thank you all. Have a great day.
Thanks, Judy.
Thank you so much, Judy, for all that great information. Hi, everyone. I think we go till about 1:30, so I'm probably going to rush through a couple of slides to kind of get to the meat and potatoes of our presentation. Technical issues happen to me all the time, so it's totally understandable that the world we live in is imperfect. So with that in mind, hi, everybody. I am Samantha Schrage-Bunk. As Judy mentioned, I am a health policy strategist with Missouri Foundation for Health, and I'm going to be going through a little bit today about your Medicaid rights as a recipient in Missouri. So full disclosure, I'm an attorney by trade, but I do not practice at MFH. I was previously with Legal Services of Eastern Missouri, dealing with Medicaid enrollment, appeals, marketplace enrollment and appeals, and things like that. So we don't provide any direct services at MFH, but we do provide a lot of education, information, and we do some advocacy work in the health policy arena as well. So with that in mind, just a really quick little bit about us. Our mission is to eliminate underlying causes of health inequities, to transform systems and enable individuals and communities in Missouri to all thrive. Next slide. We work in partnership with many communities and nonprofits. We try to transform systems to eliminate inequities within all aspects of health and to address social and economic help shape health outcomes, such as social determinants of health. We're trying to build a more equitable future through collaboration. We do a lot of convening work, bringing people together, knowledge sharing like we're doing today, and strategic investment. Next slide. All right. So now to what we're all here for. First and foremost, I thought Judy did a great job covering this for Medicare. I wanted to just very, very quickly go through Medicaid in Missouri, some really quick basics, because I think it helps lay the groundwork for what we're going to go into today. So this might be new information to some folks. Some folks might already know about all of this, but just in case, it is good to have the basics covered. So currently, Medicaid in Missouri covers these groups based on eligibility factors. So this is going to be based on your household income size, things like your income information, and also in some cases, what assets you have as well. But generally speaking, based on those factors, you may be eligible if you're in one of these groups. So this includes pregnant and postpartum women. We recently, in the last few years, got up to 1 year of for postpartum moms, parents who have a child under age 19 in the home who have limited income. Low income children actually make up a big portion of Medicaid recipients in Missouri. So, this includes kids who are on what's called Mo Health Net for Kids, and also children who are still considered low income by Medicaid standards. So, that would be above 150%, but below about 300% of the level. Uninsured women, so this is for limited services between ages 18 and 55. So this is what's called our Uninsured Women's Health Services Program. This mainly focuses on specifically well women services. So things like pap smears, breast exams, birth control, things like that. And then women with breast or cervical cancer. So this would be women who are under age 65 who get diagnosed by a Medicaid provider. So that is kind of a specific requirement for that coverage that a lot of people don't know about. A lot of times the way that this comes about that people go into this program is maybe they're on a different type of Medicaid. They might be in the expansion population or something like that. And it is discovered at a visit by a Medicaid provider. But the Medicaid provider in this case does have to be the first to actually give the diagnosis, which can make it a little tricky for folks who are maybe uninsured and then find out they are unfortunately in this tough situation. Also, low income individuals between age 19 and 64, what's commonly known as the expansion population, and then what Missouri calls ABD, aged, blind, and disabled individuals. So, this is individuals over age 65, those who meet the requirements of Medicaid for the blind or disabled. Next slide. All right. I know we have probably a lot of different people in the room. So when we go into Medicaid rights, I specifically wanted to go into the basics of managed care because that is how most care for folks who are on Medicaid in Missouri is handled. I'll go into just a few minutes of who actually qualifies for managed care and who can opt out of managed care, but it's kind of a different system that our state uses. A lot of states use managed care programs, but it can be a little confusing. You're usually going to get multiple cards in the mail if you're in a managed care program, things like that. So it's just good to know a little bit of the basics about how this works. So what is managed care? So managed care organizations are commonly referred to as MCOs. There's a lot of alphabet soup in my presentation, so I'm going to try and go through all of the acronyms to make everything make sense because even I get very confused and I've been doing this for years, sometimes with all the acronyms. So these are the companies which manage the care of the individuals who are enrolled in their programs. So who's automatically enrolled in managed care? Like I said, it is most of the groups in the state, but not everyone. So automatically it's going to be children, pregnant and postpartum women, newborns, and families. So when I say families, I usually mean parents, like we talked about before, that are eligible for Medicaid that have children under age 19 in their home, and they are eligible based on all the standards for Medicaid for parents in Missouri. So who are the companies in Missouri that are handling this care? The names, again, if you're in managed care, you know someone who is, they probably received 2 cards when they enrolled in Medicaid. They probably got one that says Mo Health Net, and then they also probably got one from one of these companies. So it's either going to be Healthy Blue, Home State Health, United Healthcare, or Show Me Healthy Kids. Healthy Blue is a subsidiary of Blue Cross Blue Shield of Missouri. Home State Health is a subsidiary of another company in Missouri. United Healthcare, I think we've all mostly heard about, but if not, they use the same name here as they do for their main market insurance plans. And then Show Me Healthy Kids specifically is for kids who are in foster care or receiving foster care services. So that's who would be eligible there. All right, so who can opt out of managed care and how does that work? So the reason I wanted to start with the managed care is because some people do have the option to opt out of it, but not everyone does. And not everyone knows how to go about that process if they'd like to. So some individuals might wish to opt out of managed care and instead pursue what's called fee-for-service Medicaid. So the main difference specifically between fee-for-service Medicaid and managed the models and how depends on how, I'm sorry, the payments are structured and how healthcare is delivered to the patient. So fee for service reimburses providers for each service rendered. It's kind of a volume model, while managed care involves a system where the insurance companies pay a fixed rate per member per month to cover a range of capitation or a per person model. So who is able to opt out if they so choose? So you'll see kind of a trend in this list here, but I did want to list all the programs. So this can be an option for people who are in Mo Health Net for people with disabilities, Mo Health Net for the blind and visually impaired, Mo Health Net for seniors, so those over 65 who are receiving Medicaid, the AIDS waiver program, the breast or cervical cancer treatment program that we talked about on a few slides ago, the uninsured women's health services program, or those who have Medicare coverage. So you'll see that a lot of these fall into disabled categories. That's usually who can choose to opt out of managed care and choose different providers, but not necessarily, as you can see, there are some other groups on there. All right. Can I change managed care plans? So if you're in managed care, maybe you don't have the option to opt out, you don't fall into one of those categories, but you want to change managed care plans. You have the right to change your managed care plan for any reason you so choose within the first 90 calendar days of your enrollment. So it can be just because you feel like it. It can be because, maybe you've heard things about one plan and for your own personal reasons, you feel comfortable with somebody else. In those first 90 days, you don't have to have a reason. You can just do it for any reason within those first 90 calendar days. However, after that, it does get a little more difficult. So those deadlines are really important to know. So after the first 90 days, you can change for what's called just cause. And I've listed some examples. This is not an all exhaustive list, but these are some reasons that if you feel you need to change managed care plans after 90 days, that 90 days has expired, but then you are having to go through this process, here are some reasons that you can do it. So you can do so because of complaint or appeal. Maybe you or your child has a doctor they want to keep. You had it before you went into the MCO and they're not with your current MCO. They're with a different one. You can apply for that reason. If your doctor is culturally insensitive and you're currently with refuses to fix the issue appropriately, you can raise that as well with Mo Health Net. You can do it because you want to allow your whole family to be on the same health plan. Maybe you're both in Medicaid, but one of you is in Healthy Blue and the other one's in United Healthcare. You'd really like everybody to be on the same plan, but you're past that 90-day period. A valid reason as well. Poor quality of care. You can do so for this reason. It is a just cause reason. I wrote on here must be proven because this is a little trickier to prove. You have to prove to Mo Health Net that you've received poor quality of care. You have to provide documentation. It's just a little bit more of a process. So it is a reason. You are welcome to pursue that. I just wanted to let people know it does tend to be a bit more of a beast of an avenue. So if there's another reason on this list or a different just cause reason that is valid, then that might be a little quicker. These two come up a lot because there are no covered healthcare services in your area. Medicaid has certain rules around travel for a provider and how soon you have to be seen, as is your right for services. If you live in, especially a rural area, sometimes has this issue, and there are just no providers around you that are in that managed care organization that you were automatically enrolled in. 90 days have passed and you didn't realize that, and now you're there. You can say, this is the reason I have just cause to change, and you should be allowed to do that. Same here, there are no doctors in your area that are able to meet your healthcare needs that are skilled in it. So especially if you need maybe a certain kind of specialist and the closest specialist you need within your MCO is, 300, 400 miles away, side of the state, then you can also do that. With that, I want to note specifically, you do have the option if you're running into the situation where you have a doctor you really like, you were put in a managed care plan, they're not in your managed care plan. At any time, you can request that they opt in care plan. So maybe they're with Healthy Blue, you're with United Healthcare, you really want to keep them, but they are not in with that other provider. You can ask the provider to opt in. So they would contact the managed care organization and ask to be opted in. That can be hard to do outside of the contract negotiation period that every MCO goes through with the state. It's not impossible by any means. It does happen, but it does require some work on the part of the MCO and your provider. So it is up to them whether they want to pursue that and whether they end up being included. But you certainly can bring that up with the physician if it's important to you. Next slide. Okay, I'm going to go through this one pretty quickly because a lot of the general rights that apply for Medicaid patients are very similar to what Judy went through, specifically with the rights for Medicare patients. So I'm just going to kind of list these off so everybody knows, and you can, of course, reference these. I've provided my slide organizers, so you will have access to them after the presentation. So Medicaid patients have the right to be treated with respect and dignity. You have the right to receive needed medical services. A point on this one, again, Medicare, you have this right as well. I think where it becomes tricky, and in my previous practice, what I used to see a lot is what is medically necessary often gets kind of questioned sometimes by either your MCO or by MoHealthNet. I used to see this a lot specifically with specialty services such as orthodontia for kids. There are certain tests that have to be met in order for braces for kids to be covered, and that can be tricky. It usually has to go through an appeal, and it is very difficult. You still have that right to receive those services, but whether the state will pay for them does depend on the medical necessity. That is something you have to prove, but you do have the right to receive those services. So you should always assert that right and do your best to get those services if it's something that you're seeking. Again, you have privacy and confidentiality rights subject to state and federal laws, just like you do with Medicare. You have the right to select your own primary care provider within your network if you're in an MCO. Outside of that, you can go through that process we talked about if you need to switch MCOs, depending on what time period you're in, et cetera. You have the right to refuse treatment, to receive information about your healthcare and your treatment options, participate in decision-making about your healthcare options, have access to medical records and to request changes. So if you get a copy of your medical records and they say you had a surgery that you know you never had and that's an error, you can request to have that changed. Participate in the decision-making. Have someone act on your behalf if you aren't able to do so. You can assign what's called an authorized representative to make decisions for you. You also have a right to be free of restraint or seclusion from a provider who is not treating you right. So they're making you do something you shouldn't do, punishing you, getting back at you, or just trying to make things easier for themselves. Also, you have the right to you exercise these rights without retaliation and to receive one copy of your medical records once a year at no cost to you. Next slide. I see a few questions in the chat that we're going to get into something very similar. So if you just hang tight, I should get into that. And if not, we will have a section for questions at the end, depending on time. Okay. Hopefully you can read this. It looks like my slide flipped over a little bit with the photo. I apologize. We have a new template that we're still learning a little bit. But I want to talk really, really briefly about early and periodic screening, diagnosis, and treatment, not commonly known as EPSDT. So I know this may not apply to everybody in this group, but I wanted to just provide a really, really brief note about the EPSDT benefit. So this provides comprehensive preventive healthcare services for children who are under age 21, who are in Medicaid. The idea behind this being that early screening, diagnosis, treatment, prevention services are going to be more cost effective and also better health outcomes for the patient in the long run. So that's kind of the idea behind this. So this includes services such as well child visits, mental health services, dental, vision, hearing services. Again, this is not an all-exhaustive list. For the sake of time, I have that link that was on that last slide. If you click that, it has a link to the CMS guide for EPSDT that goes into a lot more detail than I have time to do today, but that goes into some more information I think is handy to have. Rights to your health information as a Medicaid recipient. You have the right to, as we said, access, control your health information, the right to request copies and request changes if it's inaccurate. As Judy talked about, you have your rights under HIPAA as well. To request a copy of your records, as I said, you can do so annually without a cost. The process for that, just so everyone's aware, you can complete the DSS request for individuals access to protected health information or PHI form to request access to your records as well. All right. The thing I think that people really are going to be, I hope, interested in, this is something that's really big that we've seen a lot of issues with. So I wanted to make this kind of the biggest part of the information today is Medicaid redeterminations. So Medicaid redeterminations are commonly called annual renewals. They were paused during COVID and resumed April 2023. And the reason those dates are really significant is because, as you may recall, Medicaid expansion went on the ballot in 2020. I was part of the team in my previous life that sued the state because they refused to fund Medicaid expansion. We won at the Supreme Court, and now Medicaid expansion recipients have been able to enroll since October of 2021. Why all that's really relevant is because there are a lot of individuals who were new to the program, who had never been eligible for Medicaid or had never been eligible during that period, that had never received what's called a redetermination. It was very foreign because it's something they never had to deal with. And then they resumed and people got very understandably confused. So what generally should happen is you will receive a yellow form. And of course, I put it in yellow, but of course it didn't translate right, so it looks red, but it should be yellow. The form should be around your anniversary month, which is the month you enrolled in Medicaid. So say you enrolled in April of 2024, you should get the form a little before April of 2025 or very close to that time, and you have limited time to return it. Usually, I believe it's somewhere between 10 and 30 days that they will give you the note, but if you do not update and return the form on time, you have until 90 days have passed to return the form before you will need to actually reapply. So what we're seeing happening a lot, especially with things like USPS having some delays, there's a lot going on right now. We're seeing people maybe not getting the notices on time, or they're not being sent to the correct address because the address hasn't been updated in the system, or they thought they provided it and it hasn't been provided, so the form got sent to the wrong place. All things like that. What will happen is ideally you want to return that form on time. If you do not return it on the time period they give you, but it's before 90 days, I would highly recommend you either contact the state yourself through the call center. I know the call center can have a long wait time, although it has improved. It's still an imperfect system, and we work with the state a lot. We totally recognize that. Or contact an advocate, and I'm going to list a couple options for that on here as well to help you with that process. So if you're before 90 days, do not submit a new form. Ideally, do not reapply for Medicaid. Even if you get something from the state, if it's within that 90-day period, then really you should be trying to contact the state about your current application. Because what happens if you submit multiple applications is it confuses the system, it confuses the workers, it can cause further delays for you that you just don't want. So ideally, you would either be working with the state, or if you can't get through to them, working with an advocate to try to work on your behalf as an authorized representative to get that figured out for you. But if you do not receive the form in enough time to return it by the deadline, more than 90 days pass, you have some options. Next slide. Oh, uh-oh. Well, that is not my next slide, but let me see what's going on here. So I had, I think, 2 or 3 more slides. Sonia, Judy, whoever is currently running them. Okay, here we go. All right, sorry about that. Here we go. So if you are found ineligible and choose not to appeal, just so you know, you may lose coverage or have unpaid medical bills. So say the 90 days have passed. Here we go. Oh, nope, there is one slide missing. I was like, this seems like we're too far ahead. So what I'm gonna do is, if we don't have access to it, it should be a slide that says your rights regarding Medicaid redeterminations. And it's got a blue background for anybody running the slides, but should be back right there. Okay. I was gonna say, if not, I will work freeform. That's not a problem. Make sure everybody gets the information after. So sorry about that. So your rights regarding Medicaid redeterminations. So the way it's supposed to work is the state is first required to review your renewal via their electronically available information. So this is things like work notes, anything that they have access to electronically. They are supposed to look and see if they have all the information they need to determine if you're still eligible for Medicaid before they ever send you that yellow form. If they can determine your eligibility without your help, then that's what they are supposed to do. And that does sometimes happen. You may just get another renewal notice that says, congratulations, we have verified you're still eligible for Medicaid based on our data available, etc. And you don't have to do much. If they cannot verify eligibility, they will send you that pre-populated yellow form, which you have a right to update with your current information in order to retain coverage. So you can literally write on the form in a pen or pencil and send it back to them. Maybe your income has changed, maybe it's gone up or down a little bit. Just make those changes and send it back to them. Most importantly, though, you have the right to receive notice if they reduce or terminate your coverage. So if they determine for any reason through their process that you are no longer eligible for the services that you were receiving, maybe you're eligible for a lesser category, or they think you're not eligible for any category, you have a right to receive notice about that in a timely manner. So reduction of coverage, just so you know what that looks like. Maybe you were eligible for expansion previously, and then they look at your income and your eligibility and say, no, this person is no longer eligible for this, but maybe they're uninsured for They're eligible for uninsured women's health services. That provides, as I said, more limited coverage, only really related to well woman services and things like that. It is not comprehensive coverage, with which Medicaid expansion is much more comprehensive. They would have to let you know that they're doing that. You also have the right to appeal an adverse action. So an adverse action is what's stated above. They either terminate your coverage, cut you off, or reduce your coverage. And you also have the right to know the reason for that adverse action. So it may not be clear from the notice received. I make this clear because in many, many years, I've been doing this for over 10 years now, both in and out of law school, and the notices that people receive are not always super clear. It's something that the state is aware of. There are many reasons for it. They have been working at it, but it's still an imperfect system for sure. So you might get a notice. I've seen some that have 4 different reasons for why your Medicaid's being terminated that all contradict each other. This is not intentional, but it's an error that's sometimes not always caught either, unfortunately. So if it's not clear from the notice received, you do have a right to contact the state, and they do have to give you the actual reason that you're having that adverse action taken. If you are determined ineligible for any reason, you have 90 days from the date of the decision to appeal that action and request a hearing with the Family Support Division. Next slide. And it should be, the next one should be the one that has redetermination. So it's what we originally went to, redetermination things to remember. There we go. Okay. So if you were found ineligible and choose not to appeal, I know I'm repeating myself now because we're a little crazy on the slides. This is what happens sometimes when you have to combine presentations, and we all try our best, but it's just imperfect. So we work with what we've got. You might lose coverage or have unpaid medical bills. So if you're found ineligible and you decide, I'm not going to deal with this, more than 90 days pass, you will probably lose that coverage if you take no action or have unpaid medical debts. However, if you choose to appeal, your coverage will continue while waiting for the results of the hearing. So you don't have to pay back coverage you receive while you're waiting for that hearing, even if you lose the appeal. Sometimes it can take a lot of time, depending on how long the wait is to get an appeal. You still have the right to it, but it might be a little while out. While that is happening, your coverage should still remain active. And even if you lose, they can't make you pay back the services that you received during that time. One other thing you can do is call your local legal aid. So I've listed all the different legal aids here. If you click the link that says legal aid right there, it has a link to the map, because depending on where you are in the state, you might be sent to a different office for services. It's based on your location. And then obviously eligibility is determined through a variety of factors, whether you're eligible for services. But I always tell people to call first, call or check the website for help if that's the situation that you're in, because if you can be eligible for help, they can be extremely helpful. Next slide. And the next one should be medical debt, the blue one. So one back. Here we go. Perfect. Okay. So really, really quickly, I know I'm going over on time. So I'm going to be as quick as I can, and then I'll just kind of list what the resources are on the next page. Your rights as a Medicaid patient when it comes to medical debt. So in general, providers are not allowed to bill Medicaid patients for services that Medicaid is supposed to cover. So this is if it's a covered service, you're at a covered doctor, and they still refuse to pay it. That's not supposed to happen. However, there are exceptions to things like co-payments, co-insurance, or for services not covered if you agree to pay out of pocket. So right now, there's not a lot of co-payments and co-insurance going on in the state of Missouri. There is some, but all of that is kind of subject to change. The state does have a right to do certain things with Medicaid. They haven't chosen to right now, but just so people know, they do have the right to impose certain payments and co-insurance if they so choose. That could change in the future, but that's for the most part not how it is right now. They're mostly relatively low in comparison to what some states charge. However, if you agree to pay for services out of pocket, maybe you go to a provider, they say, we're not in your Medicaid plan, we don't accept Medicaid or whatever it is, and you still choose to get services at that provider, unless it's a certain exception like a medical emergency or you're out of state or things like that, generally speaking, you're going to be responsible for that. So it's always important to check. Medicaid providers are generally prohibited from balance billing you for services that are supposed to be covered. So they cannot charge you more than what Medicaid would pay. They can't try and make up the difference of what, say, private insurance would pay and Medicaid would pay from you if it's supposed to be a covered service. And if you are billed for a service incorrectly, you should reiterate your rights to the provider, make sure they know about your Medicaid coverage, give them the information, give them your cards, and verify that the service received was a Medicaid covered service. So usually a billing department can help with something like this. But again, you can always reach out to an advocate or advocate on your own behalf if you believe something is an error. And then I'll hop to the next slide. Background. Right here. Perfect. All right, so legal assistance. Depending on what part of Missouri you're in, legal services might be able to help. Please note, not all of the parts of the state have resources to assist with medical debt cases, but some of the parts of the state definitely do. Again, it's always worth checking to see if you qualify and if there is a service available to you. So there's a link to all the offices there. $4 specifically is a really great nonprofit organization that assists patients with medical debts incurred from services that are provided by a hospital. So if you get a large medical bill from a hospital that you're dealing with, we recommend that you reach out to this organization to see if you qualify for assistance. That's something sometimes they can help you with to negotiate or get that bill written off. This is regardless of whether you have insurance or whether financial aid has already been applied. They can work with you to at least advise you if you qualify for their services. And all their services, I believe, are free of charge. Assuming neither of those are something you qualify for, it's just good to have some direction on how to advocate for yourself. I've listed some good CFPB resources here. There's a really good article that walks through what to do when you're faced with a medical debt collection. And then a book that is free and it's available online searchable form talks about all kinds of debt. So it talks about mortgages, it talks about credit card debt. It's just a good resource to have in general, but they have a whole chapter on medical debt specifically. It's published by the National Consumer Law Center. They are a really great resource on medical debt. They do a lot of work in this arena. And Chapter 11 specifically talks about medical debt. And again, it is free of charge to you. So if you follow that link, you can do that as well. All right, and I know I'm over on time, but I think that is my last content slide. I've got another one that has, if anybody has any questions. Oh. All right.
Samantha, you had some questions in the chat. To be eligible for Medicaid, the person needs to be Missouri resident for more than 5 years.
So not to be eligible for Medicaid in general, you don't have to, there's no residency requirement for people who are eligible for other purposes. The reason this usually comes up is if someone is an immigrant of some sort. So if they have a certain kind of immigration status, if they are not either a permanent resident via citizenship or something like that. If you have, say, a green card, usually you have to be in the United States for 5 years before you can get Medicaid, and that applies to most immigrants. Refugees, and there's a couple other groups that I won't go through right now because it would take us a while, but there are definitely some groups that doesn't apply to. But generally speaking, if you're a US citizen, you do not have to be a Missouri resident for more than 5 years. It mostly comes up with cases of immigration status.
Okay. An individual over 18 years that is disabled and is in the process of applying for SSDI could apply for Medicaid.
Yes, they can. They can apply for Medicaid. If they, in the event they are approved for SSDI, that could affect their application, not necessarily in a negative way. Generally, people who get Social Security disability are going to be eligible for Medicaid, except in certain circumstances or based on certain assets and things like that. But they can definitely apply, and anyone who's helping them apply could walk them through that process.
Okay, the next one's a little long. I have an individual in residential placement who has been getting told she is ineligible for disability Medicaid when she has had it all this time due to her disability. She has a comp waiver for placement, and we are not getting straight answers at all for what to do or to appeal. They have told her she does not need to appeal because of her comp waiver or placement in the ISL. Who can we contact directly for help with this?
Yeah, so I would advise her to contact her local legal aid if they haven't already, just to see if that's something they can assist with. I can't guarantee, again, based on resources and funding and staffing and all those things, that they can help. But if they cannot help, they usually can point you at least to another organization or some good resources that should be able to help or at least get her started.
Does Missouri Medicaid ABD automatically enroll into Healthy Blue? This happened age 19.
So they're not supposed to. It's supposed to vary which group they get fallen into. But even if they do, again, in that first 90 days, they can choose to move. If they want to move after those 90 days, if you go back to that other slide to reference, there are other reasons for just cause that they might be able to move if Healthy Blue is not working for them.
Is there a way to dispute high spend downs or assistance for that?
Again, you can contact local advocates. That's a really tough one because spend downs tend to be accurate in my experience, but high spend downs are just a really tough thing because, and I've worked with a lot of clients who had this issue, and it basically makes it very hard to actually gain your coverage because you have to meet that spend down every month. So if it is high, I totally understand it's a really difficult situation to be in. Again, you can contact your local legal aid. They do some work to make sure that that is thing they would do, but if it's found to be accurate by them as well, there's not a whole lot of assistance for that that I'm aware of, but you can always ask that question of them.
Okay, last one. If someone ages out of Mo Health Net for kids, are they automatically transferred over to the new Medicaid plan?
So what's supposed to happen is that if they're aging out, they're supposed to be ex parte. They are supposed to look at all the electronic information they have available, like they do for everybody else when they see that they're going to end that coverage and phase out and see if they're eligible for something like expansion or any other category. If that does not happen and they just get a termination notice, they can basically contact the state and let them know, I was supposed to be ex parte. That's the faster process, or ask them if they should reapply.
Okay, I know that was quick, and we are over on time, but any other questions for Samantha or for Judy before we close out?
And again, I did put my contact information there. Correct me if I'm wrong, but I think we're going to share the slides after the presentation. I know you all were recording. So if there are any additional questions, please let us know. Again, we don't provide direct services, but we're happy to try and send you any resources we can or provide any information to help you with whatever you need.
Thank you. Sonia, Judy, and Samantha, thank you so much. We will definitely be providing slides and any other additional information after this concludes. Please remember to take the survey, and this will be available for recording. Our recording will be available again in the Turning the Life Course YouTube channel. So if you missed any of it, you can always get it there.